So what type of anesthesia is best if you want to consider undergoing a deep plane facelift or neck lift? Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. So there are three types of anesthesia approaches for a facelift. So one is what we call local anesthesia. We just numb up your face with Novocaine, and while you're fully awake, we'll go do our work. The second option is a Twilight or conscious sedation. And Twilight is great. You get IV, some sedatives, keeps you calm and sleepy. We numb up your face with injections of Novocaine. With Twilight surgery, we can go deeper and be more involved. Whereas with local anesthesia, you can't go super deep because there's a lot of other functional issues that come into play. The third option is general anesthesia. General anesthesia uses a breathing tube. You go fully under, sleep, you're not conscious, you're not aware, and you're fully pain-free. And in this approach, we do not need to use Novocaine to do any sort of surgery. You're already numb and we can do all of our work. Now, what do I prefer? I always prefer general anesthesia. The reason I like general anesthesia, we can monitor your nerves much better because the Novocaine tends to kind of numb up the nerves and can also numb up motor nerves, the facial nerves. So monitoring of the nerves can be a little bit more unpredictable with Novocaine. In general anesthesia, we don't utilize Novocaine, or I don't. And that gives me a great opportunity to really monitor your facial nerve, know exactly what's happening, and keep that to the safest possible place. Now, the disadvantages, you do need a breathing tube. The recovery is from emerging from the anesthesia is a little bit longer, but overall, with my perspective, I love general anesthesia for these deep plane facelifts and deep neck contouring. Now, I have no problem with conscious sedation. I have no problem with Twilight, and some people like local anesthesia, but it's critical you discuss this with your doctor to make sure they're comfortable with the approach that they use. If they recommend to you one way or another, don't try to sway them to another way because you want your doctor to do it the way they're most comfortable with. You need to share your concerns, get their input, but allow your surgeon to use the methods, whether it's anesthesia or otherwise, to do the best that they can. And one final, very critical part of this is the anesthesiologist. For both conscious sedation, Twilight, as well as for general anesthesia, you need an anesthesiologist or an experienced nurse anesthetist. I use anesthesiologists, I love them. I've been using some of the best people around, and that gives me a confidence of support as well as that they're going to take care of the anesthesia, I'm going to take care of the surgery. So in short, really, I would say if you're undergoing deep plane facelift, you should really know that the two most common methods are Twilight, conscious sedation anesthesia, or general anesthesia. My preference is general anesthesia because we can better monitor your facial nerve. But discuss this with your surgeon and make sure they're comfortable. Make sure there is a great anesthesiologist or nurse anesthetist with you. And please comment about this post, like, and also follow us. We appreciate it.